Hi, Dr. Arndt here. I thought I'd go over a little bit about posture today. A lot of people think that posture is just like the one thing that your parents always nagged you about. You know, why you're standing, get your shoulders back and everything else, and people are standing like this. Anyway, I thought I'd explain some different consequences with bad posture because it's your fight against gravity. The better your posture is, the better you're going to win that battle. So if we look at this, you can see the spine inside. Your posture is a reflection of what's going on inside your spine. You've probably seen people that are really hunched over. If you look at this, we see, if I move this forward, this is a person that you see that's got that big hunched back, okay? It's putting a lot of stress back through here. You see where the neck is. If you look at a low back, if we just change this for a second and look at a low back, you can see there's a bigger curve. You've probably seen people with these really mean too much of a low back curve. There's also people at work. If you look at it now, they're texting on their phones, their heads are down, and they're also sitting at work working on computers where their heads are forward. Just to get an idea, your head weighs about 10 to 12 pounds. It's actually quite heavy. If you move it forward, you can see 15 degrees, that head effectively becomes 27 pounds. If we move it forward even further, let's move it to 45 degrees. That's 49 pounds of pressure on that back. And moving it forward even more than that, you can see it's 60 pounds. And you see people all the time working on their phones like this, 60 pounds of pressure on their back. Now, why is that critical? If we look at that position where you have that big extra curve that's called a kyphosis or a hyperkyphosis, too much curvature, your muscles come into play. There's certain muscles that we use for posture all the time, and they can do it all day long if you have decent posture. As you go into an abnormal posture, there's other muscles called phasic muscles that come into play that are not supposed to do that. When they tighten up, they're not getting blood flow. As they don't get blood flow, they start getting inflamed. They build up lactic acid. It results in trigger points, which become little hyper-irritable nodules that generate pain other places in the body. And if you can look here, you can see these muscles here are coming into play and will develop trigger points. And a lot of people say, oh, my shoulders are so tight. Why is it happening? Because they're holding this head that effectively weighs 60 pounds. If we look at a lower back, it's actually in a different position. You'll see these muscles, as it's coming through here, these muscles in the lower back are going to get tight, as well as the buttock area. Okay? They get actually weak, but they'll still develop spasms in there. And of course, we have the abnormal curvature that actually can occur with a person leaning forward. We talked about that. See how the change in this curvature here? Why is that important? Besides all the pressure on these muscles? Well, let me show you. If we look at what's happening inside the spine, okay? Here's the spine. It's inside, underneath these muscles. If we remove these muscles here, you're seeing the spine, and you'll see this area of yellow, which is the spinal cord. It's your connection between the brain and the rest of the body. As this curve changes, it stretches your spinal cord. And the impulses are reduced. They're actually abnormal. And they're going to all the organs in your body, all the muscles of your body, and it will affect how they operate. And you can see the reversal stretches the cord to a huge degree. You can also see there's abnormal pressure on the bony structures of the spine. When there's that much pressure, those bones will start to increase in size, and they start impinging onto the delicate nerve tissue that's coming from there to the rest of the body as well. This is why posture is important. You can also see a collapse of the lungs. When you expand that, you can breathe better. Your diaphragm's not compromised. It can actually move up and down to be able to breathe. Your diaphragm's the primary muscle for breathing. It also reduces pressure off the heart and the rest of the body. So that's why you have to have good posture. Now, what is good posture? Some of you may not even be able to get into a proper posture because of years of being in abnormal posture. These tissues get very restricted. So one of the things you can do is you can use a foam roller. And if you look here, you'll be able to see a person lying over the foam roller. It stretches out their upper part of the back. All right? Primarily, that's the best thing you can do. If a person has an increased curvature in the lower back, you can't really use a foam roller to be able to correct that unless you have a larger curvature in the upper back. The other thing is, once you've done that, the way you typically would stand is from the feet up. The feet should be pretty much straight ahead. You should be able to contract where you're trying to push your knees outward or your feet outward, which actually automatically will tilt your pelvis in a better position, which flattens your lower back, and you should lift your chest up. A lot of people trying to have good posture, they do this. That is not good posture. Your chest should come up, your shoulders should drop back automatically, and then your head should come back. Remember, your head being forward, as it increases, it's going to have more and more pressure on those muscles. So it should be upright, and that would be a proper posture. If you can't get into that position, you've got to work on that foam roll until you stretch these tissues out to be able to stand up in that manner. Anyway, thanks very much. We'll see you next time. If you're interested in learning more about how to maintain an active lifestyle as you get older, please subscribe so you can get notifications. Thanks.